Hi, my name is Dr. Slaven Balog. I'm an ophthalmologist from Osijek, Croatia, and in this video I would like to present you the case of female patient aged 77. Her first visit at my clinic was in July 2017. 5 months before her first visit to our clinic, she noticed a dark area in the nasal visual field of her left eye, which is her dominant eye. Her right eye was considered borderline amblyopic. This is her weaker eye. She had no previous eye injuries and had been wearing spectacles since childhood. During the visual assessment of the following were found. On the left eye, the best corrected vision could not be identified. The OCT examination revealed that this was due to a retinal detachment as shown here. She soon underwent combined phaco and pars plana vitrectomy procedure in a clinical institution by a retinal specialist. Post-operative findings showed the retina nicely reattached after the combined procedure with the intraocular lens safely positioned in the capsular bag. However, during the following visit in my clinic, we saw that the vision of this eye had not improved significantly. Since OCT findings again showed that the retina was firmly attached, the unimproved visual acuity was thought to be due to the wrong IOL power selection. During the visual assessment, we found that the uncorrected distance visual acuity on the left eye was 0.02 decimal, with a best corrected distance visual acuity of 0.72. This was achieved with a correction of minus 6.25 diopter sphere with a minus 3.5 cylinder. After further consultation with the retina specialist, we decided that the supplementary IOL could be considered to improve the unaided vision on the left eye. The first Q AddOn lens was chosen because I had previous experience with this lens family, and in my hands it proved to be safe and effective not only for spherical but also for astigmatism correction. After consultation with the manufacturer and using the online calculator on their website, after toric secondary lens was chosen to be positioned at 111 degrees. The load of the AddOn lens, a non-preloaded injector, was used as recommended by the manufacturer. It is important to ensure the correct anterior-posterior placement to verify that the lens is not upside down in the cartridge. The lens is positioned in the loading bay in a reverse U position. This helps an easier implantation into the ciliary sulcus. Important is to make sure that all haptics are safely positioned under the hinges before closing the cartridge. This is the video of the implantation. The application guidelines should be closely followed to ensure a successful implantation. The cornea was marked on the steep meridian. The two fine lines on the posterior side indicate the flex axis of the lens, which has to be aligned with the corneal meridian marking after the implantation. Using a 2.4 mm incision, ensure that the tip can enter the anterior chamber, facilitating that the leading haptics slide under the iris into the ciliary sulcus. I used a more cohesive OVD, which helps to create spacing for an easier sulcus placement. Haptics that open on the top of the iris should carefully be positioned in the sulcus individually, using a rotating motion in the horizontal plane. The toric AddOn was rotated into the required axis, and all viscoelastic material was carefully removed from the eye, including from between the two lenses. The use of myohol or similar myotics are advised before closing the case. Post-operative medication corresponds to that after cataract surgery. We reached an uncorrected visual acuity of 0.78 decimal with the best corrected vision of 0.8. This means that with the help of the secondary lens, we basically achieved the maximum possible correction for this patient. The take-home message of this video is that treating ocular pathologies in order to reach stable visual status is of utmost importance before considering any tools to improve visual quality. During a combined PPV and phaco procedure, there is a non-negligible chance that the patient will need additional visual enhancement after the surgery. In a case of significant residual emmetropia, such as in this case, a secondary AddOn lens can be used efficiently to correct the distance visual acuity, thereby significantly improving patient quality of life. Thank you.